My name is András Koltó. I'm a senior postdoctoral researcher at University of Galway, and it's my special pleasure to introduce today's speaker, Dr. Zsuzsa F Lassú from Hungary. Zsuzsa is an associate professor at Eötvös Loránd University, Budapest, Hungary, at the Faculty of Primary Education and Childcare. And she is a psychotherapist and a sexual psychologist. She was one of the first psychologists who got this certification in Hungary. In her private practice, she's mostly seeing people who survived sexual abuse. And she's one of the very few academics in Hungary who is teaching sex education, and she has a special interest in early childhood sex education. This is what she will talk about today. Zsuzsa was elected the chair of the LGBTQ section of the Hungarian Psychological Education in 2019. And it's been a special pleasure to work with her in the last 7 years as the vice chair. I'm looking forward to her presentation, and I will give my headphones to her, and I will ask her to give her presentation on early childhood sexual education and the parent's perspective. There will be 30 minutes for Zsuzsa's presentation, and then we have around 10 minutes for questions and answers. So thank you very much, Zsuzsa, for accepting our invitation.
Thank you, András, for this kind introduction, and thank you for the opportunity having this lecture. The university has Promotion Research Center and the invitation, so thanks a lot. Thank you for sharing the presentation. Okay. So today I will speak about early childhood sexuality education as a public health care intervention, drawing on Hungarian empirical studies investigating parents' views and experience. So let's start with a quick overview of sexuality education in Europe. As you probably know, in many countries, sexuality education still starts quite late and focuses mostly on biology, risks, and things that can go wrong. Early childhood is often missing from the picture or covered so vaguely that it depends entirely on how brave the educators or adults happen to feel that day. So this delay is usually based on the idea that sexuality suddenly starts at puberty, as if it comes with the acne or with the formal operational thinking, which is not. So research tells us that children develop body awareness and body curiosity much earlier. So when the adults stay silent, the children can learn something, but just not always from the sources we would prefer. So from the public healthcare perspective, it is a missed opportunity, and I think we need for cross-sector collaboration, and we need also a good, strong cooperation with the parents. So why is it so important that sexuality education starts that early, and parents need some knowledge? We know that parental sex education could be a crucial factor in children's well-being. So it can promote the later start of partnered sexual activities and safer sex practices, such as condom use, setting limits, and fewer sexual partners. Therefore, it can decrease the risks of sexually transmitted diseases, for example, and help preventing or at least decreasing the adversity of the outcomes of child sexual abuse. However, most parents hesitate to discuss sexual issues or even body issues with children. They feel embarrassment about the topic as they haven't got enough knowledge or good communication skills, especially if they grow up in sex-negative societies, sex-negative communities or families. Growing up in this way, parents frequently lack of knowledge and communication skills. And contrary to the scientific evidence, they usually think that children who learn about sexuality and sexual issues topics early will be interested in sexualities and sexual activities earlier, which is not true. We know all of this from international research, and until recently, we haven't had any scientific evidence from Hungarian sample. So, in our project, our team's contribution was to study and improve parents and teachers, kindergarten teachers' knowledge on early childhood sexuality and sex education. The research focused on parents' experience, attitudes and interpretations related to early childhood sexuality education, children's sexual curiosity, and issues of child sexual abuse and child rights. The project was guided by a public health and prevention-oriented framework, emphasizing early intervention and parental roles. The study, which I'm thinking to talk about you, so the study was conducted in 2 phases. The first phase was a quantitative survey involving over 300 parents of kindergarten students, which means children between 3 and 7 years. In Hungary, the children between these periods can attend kindergartens. The participants were primarily mothers, recruited through convenience and snowball sampling. So we could reach mostly modern, sex positive and supportive parents. The second phase applied a qualitative approach. We used focus groups to gain deeper insight into parents' reasoning, emotions, and lived experiences behind their responses. And we analyzed the data in the quantitative phase with SPSS and in the qualitative phase Atlas T and the semantic content analysis. Okay. So we asked how parents generally think about sexuality education, and the good news is most of them are surprisingly relaxed about it. Many agree that sexuality education should start early, long before puberty does. So parents who think this way were also less worried that children will be scared, confused, or suddenly run off to do something wild just because the adults answer their questions. So these parents value clear, age-appropriate information related to sexual issues as part of health education. And interestingly, parents who had early sex education themselves turn out to be even more open. So apparently talking about these things early doesn't ruin anyone after all. Yes. And we found some slight differences based on religion. I will show you some charts about it. So you can see now very, very small, not so strongly significant differences between religious and non-religious parents' answers. Not surprisingly, religious parents were a little bit more conservative related to sexuality education. But as I mentioned, by the convenience sampling, we recruited quite open-minded participants, so the differences were only small. So we asked also parents how often they experience different types of child's sexual curiosity. We can see now the results. The results indicate that behaviors such as observing parents' bodies or peers' bodies are relatively common and therefore may generally understood as part of normal childhood development. Less frequent but more sensitive behaviors such as masturbation or exposing private parts can evoke more uncertainty among parents. So we ask them how they react to these sexual curiosity things. So we can see now, as it was the open-ended question, so we can see now the results of the content analysis. We did this to reveal categories of reactions. This pie chart presents different parental response to children's curiosity about adult bodies, so the parents' bodies. Many parents interpret this situation as natural and developmentally appropriate, and answered to these acts, neglection, for example, or natural and acceptance. So while the others, you can see now the biggest proportion of answers. So the most of them reacted to these acts with teaching opportunities. So they are transforming these experience to teach something to the kids. So you can see now some quotations of the open-ended questionnaire. So the answers of these open-ended questions. For example, these parents said that yes, that's how the adults' parts look like, and mommies and daddies look different. We don't touch the others' private parts. Yes, it's sometimes bleeding, but it does not hurt you. No, Sonny, yours won't bleed. This is a quotation from a mother's explanation. So you can see now she grabbed these questions, this curiosity, and used it as a teaching opportunity. But others say something different. For example, I let her to learn the differences between her and others' bodies. And sorry, I cannot see the answers. Okay, so, and how will it change? Supported the love and acceptance of her own body. So you can see here also the teaching opportunity. These reaction types illustrate how everyday situations can either support or limit children's learning about bodies and boundaries. So this is a very natural thing to see a parent's body. Not so natural to see or to being curious about a peer's body. So you can see the answers of this experience. As shown in this chart, reactions range from acceptance to explicit teaching, also often emphasizing respect, boundaries, and the so-called underwear rule. I know that you are familiar with that. Compared to curiosity about parents' bodies, peer-related situations more frequently trigger corrective or regulatory responses. This suggests that social norms and concerns about inappropriate behavior play a stronger role when other children are involved. You can see now parents grab the opportunity as it happened in the kindergarten. So that the teacher did not make a fuss. I did not do either. I told him not to touch the girls' private parts. And if perhaps he did touch it, wash hands because girls pee through it. It is very nice. So it's interesting approach. And the other parent told that I teach him about respecting different bodies and others' private spheres. So this is also a good example of teaching opportunity. We talk about the difference between girls' and boys' bodies and the underwear rule. So we can see now a very open-minded and educated parents can react good way to this curiosity. So in the next pie chart, we can see reactions. The situation in which children expose their private parts, which is also a common thing among kids in the kindergarten. So many parents frame these moments as opportunities to introduce rules related to privacy too. Body ownership and personal safety in an age-appropriate manners. Others react by normalization. We can see an example, especially when the child is very young, while a smaller group does not intervene at all. So the teaching opportunities, for example, you can see here, we discussed that it is your treasure and you have to look after it, don't show to the others and so on. The other parents also use this word treasure. We discussed that the parts covered by the underwear are just hers, don't show to the others, don't let others to touch. They are her treasures. So Hungarian parents sometimes use these words. These parts are your treasures. Or teach something like this: don't show to each other without asking. So it is very, the permission is very important here. First, I look for information about it, the exposure. Then I realized that it is normal, so I discussed with him the rules. So you can see that also open-minded, educated parents looked for information about these things. So overall, creating teaching opportunities is the most common response. Masturbation in early childhood appears to be one of the most challenging topics for parents. This chart shows that distraction is a frequently used strategy, which may reflect discomfort or uncertainty. Why some parents accept masturbation as a natural but context dependence, others avoid addressing it directly or label it inappropriate. So we can see now the distraction. I try to involve him into something else, as he usually does it when he's bored. And you can see a lot of examples when it is the teaching opportunity. I told her that she's too young to do it, so this is a correction. I did nothing when it happened, but later we discussed that there is a time and space to do it, and it is very private business. And the other said that if it happened in public, we asked her to do it in private as it embarrasses others. We discussed that it is good and enjoyable, but to do it in private. So you can see now that compared to other forms of sexual curiosity, these reactions can demonstrate a little bit lower confidence and greater avoidance. So you can see now neglection more than in the other forms of curiosity, and the distraction. So these underscore the need for clear guidance and professional support for parents. Overall, we can see now all the forms of sexual curiosity in childhood. We asked about. So overall, creating teaching opportunities is the most common response, particularly in everyday and familiar contexts, such as observing parents' bodies or peers' bodies. Masturbation stand out as an exception, as parents more often use distraction rather than explanation. It is important to highlight that no strong association were found between reaction patterns and demographic variables. That is suggesting that uncertainty around early childhood sexuality is widespread across different parental background. We also asked parents about their views on the appropriate timing and content of sexuality education. The responses reflect a clear distinction between topics considered suitable from early childhood and those reserved for adolescence. So we can see now that when we asked, when do you plan to talk about sexual issues with your child, most of them answered that from the very early age, or a lot of respondents answered that when first asked, when the child first asked about it. So these was the most frequent answers. And we asked about whether it is part of sexuality education to talk about body acceptance, personal hygiene, sexual functioning, sexual transmitted diseases, pornography, or pleasure. And parents generally support early education related to body respect and safety and hygiene, while they express some reservation towards topic perceived as more explicitly sexual, or these more related to the sexual activities itself, like porn, pleasure, or sexual transmitted diseases, and dating that these topics should start to talk about from adolescence. So not in the early age. These patterns illustrate how parental attitudes shape the boundaries of what is considered age-appropriate sexuality education. So these parents know it very well. So we can summarize our results that foundational topics such as bodily autonomy, personal safety, hygiene are widely accepted as relevant from a very young age. In contrast, issues related to sexual pleasure, contraception, pornography, and so on are clearly restricted to adolescence. Our finding also shows some gender differences among parents, with fathers tending to hold more conservative views. They would talk about anything a little bit later than mothers, which may influence family-level communication practices also. In the second phase, in the second phase of the project, we conducted a qualitative research. In this phase, we organized focus groups of parents online. We tried to recruit participants with different social backgrounds, but it succeeded more or less. We couldn't reach religious parents. However, mothers and fathers with a different educational level participated. We recorded the online discussions and used by Atlas-T and classic semantic content analysis. So in the second phase, So here you can see the structure using Atlas-T. The structure, code structure that covers the topics of discussion. Due to the time limit, I will not present all the themes. You can see some results, for example, with this quotation. Some results about the gender discrimination. So Gender socialization and differentiation in parenting emerged in the narratives. So you can see while 11 parents told that they don't discriminate parenting by their child gender, although they mention some differentiation in toy or game selection. It is very usual in Hungary that a girl's toy and boy's toy are different in the shops, for example. So as a father, it is a quotation from a father. So as a father said, certainly, of course, those games must be selected and played with them, the girls, which are a little bit girlish, so they will be connected to feminine things later. So they told that they don't discriminate, but really they discriminate a little bit. So we asked them about child's right, but due to the time limit, I think I will skip these, and also about the concept and content of sexuality education. I just highlight the results that a lot of parents don't know exactly what is the difference between the sexuality education and the so-called enlightenment. Enlightenment, you know, when a one-time talk with teenagers, for example, about sexual issues, about sex and contraception and so on, we call it enlightenment in Hungary. I don't know which is a used word in your country, but most of the parents think that the sexuality education means this one-time talk about sex, this enlightenment. A lot of parents mismatch these two things, and some of them has got some correct information. For example, this is a quotation: "The most important difference between sexuality education and one-time sex talk that the later is just it's done, I'm over it, and I don't care what will happen." And the other said that it means that we always give them age-appropriate answers in every age. So we can see here some very exact and correct information about sexuality education. So modern progressive child-centered approach emerged in these answers. Okay. The analysis revealed the code structure of narratives regarding child sexual abuse, through which we can see a narrow and wider views of child sexual abuse. And 3 parents only from 20 participating parents. So 3 parents talk about their own children's story of child sexual abuse, but every story was about problematic sexual behavior, problematic childhood sexual behavior of another child in the kindergarten. Those who have only heard or read about child sexual abuse think that it can be perpetrated only by adult stranger. It is a widespread thinking about child sexual abuse. For that reason, they mostly handle the situation by informing the authorities and the so-called child protection signaling system immediately. So the child protection system appeared in these narratives. Participating parents were more or less informed about signs of child sexual abuse. Mostly changes in the child's behavior were mentioned. Here you can see some examples of narratives about handling a theoretical case of child sexual abuse. What would happen if your child would be involved in this? So although most of the participating parents would follow the official way and inform the authorities, some of them mentioned violent, rash actions, reactions, like this mother: "If my husband knew, I think he would not stop until he could find and hunt the person. Maybe it's rash and vigilantism, but I am sure we would do this." So vigilantism appeared in the answers, and you can see the code after the coding. that a little bit more father answered with this vigilantism than mother. Most of them would follow the official way, and very few mentioned something different. Well, it's common sense that's to the police, so I will call the police, but I don't think so. Firstly, it would lead to violence. I could not go to the police in this situation, but there would be an immediate confrontation and judging, as a father said. So this vigilantism reflects again to a narrow interpretation of a child's sexual abuse, as parents thought mostly abusive acts of an adult, a stranger adult, which is very common misconception of the child sexual abuse. Only those who had real experience of problematic sexual behavior among kids mentioned other solutions, such as contacting teachers, psychologists, or health professionals. So, before I summarize my results, I have to highlight the limitations of the study. So this was a background study for a development project. So the main goal of this project was to improve parents and teachers' knowledge about child sexual abuse. So it was a background study, and we used convenient samplings and snowball samplings. So by these we could reach mainly open-minded, somehow sex-positive parents who think sex education important for their kids. So we could reach only them. However, even these open-minded parents did not feel themselves prepared enough to provide correct information and to provide safe, inclusive space for their kids. Traditional conservative approaches without any scientific proven basis or even harmful habits and beliefs could cause harmful consequences to the kids. Lack of knowledge can cause disrespect to the child's needs and rights. It's very common in Hungary that in the name of obedience and respect of others, parents use and mishandle situation, mistreat the kids. Parents who are not educated at all or not enough in topics of sexuality and sexual development, prevention of child sexual abuse, should not be alone responsible for the children's sexual health, as it is in Hungary now. As the former government banned all the sexuality education programs from the national curricula, and it is banned to even talk about sexuality in schools, and especially in the kindergartens. So I think comprehensive, evidence-based and age-appropriate sexual education should be available in every educational institution, not only in Hungary, but I think in the whole Europe. So, summarizing our results, I can see that sexuality education should be understood as a public health intervention rather than a moral or ideological issue. For a health promotion perspective, early age-appropriate sexual education contributes to health literacy, personal agency, and long-time well-being. In early childhood, it does not involve any particular teaching about sexual behavior, but focuses on foundational competencies, such as knowing the private parts, naming of the body parts, understanding and respecting personal boundaries, emotional awareness, bodily autonomy. These skills can support primary prevention by reducing the risks and the vulnerability to abuse, and improving help seeking and establishing patterns that influence health outcomes later in life. Delaying sexual education till puberty limits its preventive potential and misses critical opportunity for early intervention. So integrating developmentally appropriate sexuality education into early childhood settings is cost-effective, evidence-based public health measure, and it supports child safety, resilience, and health, and for a long time. So long-term population health can be supported by this. And I think I am not the only one who think that in Europe we can work together for policies, and we should work together for policies that supports these goals. So thank you for listening me, and I am really interested in your opinion and in your reflections about the topic, in your experience about the topic. So please feel free to ask or share your opinion.